recording, we are doing the types of anesthesia. So in the earlier lecture, we have explained you the different types of anesthesia broadly. Now in this, we will be covering all the four different types of anesthesias in detail. For example, general anesthesia, regional, sedation, and local anesthesia. The reason I have started with the general anesthesia is it's a broadest anesthesia to cover in. So let's start with it and we will know much more in detail. So general anesthesia. So for general anesthesia, there are variety of procedures. There are three major areas by which the anesthesia is induced. Let's quickly recap on this. So general anesthesia places the entire body, including the brain, mark the word including the brain, into a state of unconsciousness, which is basically sleep, during which the patient has no awareness and feels nothing and will remember nothing of the surgical procedures. Patients are intubated. Okay. So, in general, what this statement says is in general anesthesia, patient's brain is completely knocked off, meaning is the brain and the body is put into the phase of a sleep where patient will recollect nothing. Patient will remember nothing about the entire process, entire procedures, the say for
Allahu
example hip
Akbar,
replacement or
Allah.
heart knocked off, meaning is the brain and the body is put into the phase of a sleep where patient will recollect nothing. Patient will remember nothing about the entire process, entire procedures, the say for example hip replacement or heart transplant, anything which is related to the clinical procedure. Patient will remember nothing. The patient's brain is knocked off, patient's body is knocked off, both brain and body into they are into a deep sleep mode. So that's how this is the general understanding of general anesthesia. uh, in short, the patients are intubated meaning the patients are put into a state of anesthesia and the lungs are paralyzed as well. Remember what is said here, the entire body is anesthetized, meaning it's put into the sleep. So who will breathe? Patient needs to breathe, right? If you're knocking off the patient's brain, the respiratory center in the brain will be knocked off, meaning the patient will not be able to breathe. So if you do not control breathing, if you do not intubate the patient might die. It's a severe state. So you need to have a controlled general anesthesia and intubate the patient so that of anesthetic agent doesn't block the entire region and the it doesn't kill the patient, and the patients are intubated to save the respiratory drive as well as to continue the breathing for the patients. Okay, that's in general anesthesia. Mostly general anesthesias are used for knee or hip replacements, heart surgeries, or cancer surgeries. Now, remember all these three, four terms I have used here: knee and hip replacements, heart surgeries, and cancer surgeries. These are the by far the bigger or more grave kind of a medical conditions for which the entire body, including the brain, is knocked off. So, the heart surgeries, where the heart transplantation or placing a particular valve or replacing or closing the opening in the heart, all those procedures. The cancer procedures, doing say for example mastectomy or doing colonic surgery, all those including the hip and knee replacements will be in those procedures we will be using general anesthesia. That's for the usage of the general anesthesia. Now, administration, the general anesthesia is administered with the laryngeal mask airway, injection, or both. Remember, we did inhalational anesthesia in general anesthesia as well as injectable or intravenous or the combination. It's the same. So, laryngeal mask. In the first opening slide, I explained that there was a lady where you can see that patient had a mask placed on her face. Actually, that's a kind of a mask which is used to give directly, say, for example, ether to the patient to knock the respiratory drive as well as the body and brain of the patient. So that's a laryngeal mask airway. Injection is directly putting the anesthetic agent intravenously and knocking off the anesthetic area. The side effect of general anesthesia generally are listed here. So majority of the patients may experience some side effects related to general anesthesia, and these are very light or mild kind of a side effects. So nothing as such which is a grave or the patient would feel as such. The only bad thing about the general anesthesia is there is a very slight, less than 0.01% chance of general anesthesia completely getting messed up or getting into a complexity where the patient may not be able to come back out of the surgery. It's a very rare nowadays. General anesthesias are also very safe and controlled very well. There are more than one anesthetics anesthesiologist in the OT and in the operation theater, and the procedure is well controlled. Even surgeons nowadays are having much more deeper knowledge, understanding, and can take the anesthesiologist if needed, can take over the anesthesiologist as well. So the specialties are different. Anesthesiologists are trained just to simply get specialization in anesthesia. There are other physicians who have basic understanding of general anesthesia or anesthesia in broadly, and they can also assist. So nowadays it's a very safe procedure. But just to list out some of the side effects which patients might experience: the disorientation. It's a kind of a confusing state where the patient is out of the anesthesia and is not really oriented to time, place, and person. The patient may not remember the time, what time it is, may not remember which place it is, and even may not recognize few of the persons as well. So that is in general. This is temporary and it goes off as the anesthetic agent wears off. So disorientation or mild sore throat. Remember, why the patient is having mild sore throat. Patient was intubated. If the patient was intubated, there is an expectation that they might have some kind of a sore throat because of the endotracheal tube which is placed inside the trachea of the patient. The sore throat is induced. So it's a mild, it is temporary, and it goes off as the days pass on. Post-operative cognitive dysfunction. Now this is one of the area where as the term says, post-operative, meaning immediately after the operation. Post-operative, immediately after the operation. Post-operative cognitive dysfunction. Cognitive is basically a brain functioning. Cognition is basically functioning of the brain. So obviously, as you are knocking off the brain, making the patient completely kind of a inert to the stimulations, the brain will have dysfunction, but it is only temporary post-operative period for say 48 hours at max, and that is temporary again, and this will revive after some time. So this is post-operative cognitive dysfunction. Now malignant hyperthermia is medical super urgency. So it's an anesthetic stage where the patient has extremely high body temperatures. Now, this side effect is usually related to anesthetic agent and the sensitivity to anesthetic agent. Sometimes the thermoregulation center in the brain, thermoregulation, temperature controlling center in the brain, goes completely haywire and completely is knocked off, and in that case the patient would experience the malignant hyperthermia. The term malignant is used here is because it's a very grave and extremely bad kind of a side effect. That's why when it comes to showing something in medicine, in clinical terms, there are two important areas. One is benign, the other one is malignant. Benign means less severe, malignant means more severe. So that's why the term malignant, meaning there is an hyperthermia. Hyperthermia Hyper is high, thermia is temperature. There is a high temperature, but this is a bad type of high temperature. So it's not your say 105, 106. It's way more than that. So it's a malignant hyperthermia where everyone, including the surgeon, will get involved, and the procedure will be stopped, and the patient will be taken into treatment for malignant hyperthermia. Absolute completely, there will be no procedures done on the patient when it comes to surgical part. Everyone will be after controlling the temperature of the patient. That's a malignant hyperthermia. Breathing problem, it's again, as you can understand, it's you are knocking off the patient's respiratory center, you're knocking off the patient's lungs. So there will be some breathing difficulties after general anesthesia, again temporary. And even if it is a long term, for example, say more than 3 weeks, 4 weeks duration, the patient is experiencing breathing problem, even during that period, you can ask the patient to undergo extensive physical therapy or respiratory therapy, and the breathing problems go away quickly. So that's in general about the side effects of the general anesthesia.